Hey guys, Dr. Andy here. Today I want to talk to you about shin splints and how we manage them here in our office. We see a ton of shin splints, all right, especially our active runners who are adults, but we do treat a lot of youth athletes. Think like if your kid is in high school running cross country and they develop some lower leg pain, it's one of the most common injuries that we treat, okay? So shin splints are, if you're looking at the lower leg, there's that bone that you have right down the middle. That's your shin, that's your tibia. And then if you move a little bit off to the side, not going on the inside, but going on to the outside, you're gonna hit this muscle right through here. And this is where we start to develop shin splints, okay? So it's an overuse injury, which means that we're just putting too much repeated trauma into that muscle, okay? So that can happen because, we're hitting too many miles, but also, well, maybe, you have something going on in the hip, the knee, the ankle, where the mechanics are a little bit off, causing too much stress into that muscle, and we're gonna start to develop repeated stress and some repeated pain. So our job is to get in there, break up all of the damage, and then stimulate new healing and new growth of good healthy tissue, okay? Nothing better for that than shockwave therapy. So shockwave therapy is gonna get a couple inches deep directly into that muscle belly. It's gonna break down all of the damaged tissue, and then it's gonna promote healing by recruiting mesenchymal stem cells to the area, okay? So the mesenchymal stem cells, they're gonna rebuild healthy tissue. They can clear out the pain, as well as basically, brand new blood vessel growth. So that's another way that we're going to be able to speed up the healing process, okay? So whenever we do shockwave, we make sure that we put down a layer of ultrasound gel, and the reason for that is shockwave therapy is using sound waves, extremely powerful sound waves. So we need that gel for the sound waves to actually go from the headpiece into the skin. Treatment takes about 10 minutes. There's an odd kind of like dull toothache kind of sensation with it, but certainly it's very bearable. And so we're going to treat with the focused more kind of down towards the ankle where the tendons are, but we also have a radial shockwave as well. And whenever we do radial shockwave, we treat more through that huge muscle belly. You might hit the back of the leg and the gastrocnemius muscle as well, okay? So again, treatment takes about 10 minutes in the office. We're absolutely going to eval the ankle and the knee, the hip at the exact same time, because we want to identify, is this purely just because you put on too many muscles into the leg, or do you have some kind of mechanical issue in the joints themselves that we need to eliminate so that we can kind of reduce the stress into that muscle, okay? So that's how we treat it in the office. If you have any questions, send them our way. Always remember to live with passion, not pain.